Hi, I'm Phillip Fourie. I'm a family physician from Yorkton, and I'm also Deputy Chief Medical Officer for the Saskatchewan Health Authority. At the moment, I spend most of my time as Deputy Chief Medical Officer. I do still spend some time as family physician and do some shifts in the ER as well. I think we've got a lot of patients out there that are ready to take charge of their own health. They just needed this opportunity to get the information in hand. An example that I would think of are patients that are on blood thinners like warfarin.
I'm Dr. Nelson Leong, an oncologist that works at the Saskatchewan Cancer Agency. In the cases where things are abnormal, that might cause a bit of anxiety or stress, but I think that also helps with the conversation. Because a lot of the time, if I'm in a clinic and I'm having to break bad news and let people know that there's been a change or let people know that there's an abnormality, honestly speaking, a lot of times people just focus in on that and they don't hear a lot of what comes after. This is going to lead to better communication. Patients are hopefully going to retain more of what we tell them or allow them to have kind of a two-way communication about their care moving forward rather than them just being like deer in the headlights.
I would definitely encourage providers to sign up, and that is something that I plan to do. I plan to sign up, and the reason I want to sign up is not only to take care of my own health care, but to learn on what is the things that patients can see so that I can know what they are looking at when they're looking at their own health record. By getting their own results, they can be part of that team that manages their care, because they are going to be interpreting those results when they see them. But it's going to be important to have that discussion that even though they are seeing the results for themselves, it is still important to follow up with the physician, and it is still important to have that discussion on the context of this.
Part of that engagement is instructing people what to look out for, what sorts of lab results or lab tests need to be done, but also expectations for what sort of lab results would require them coming back in.
When I'm able to provide that discussion beforehand, and I know in the past we sometimes rushed over that because we will have the discussion because we are able to have that discussion when the results come back. The thing is, there are things like false positive results, there are things like false negative results, and to put all of that in context, there's still a very important role for that physician and patient interaction. There are some patients that might be anxious, but what we can do is we can have that discussion beforehand and say, if you feel anxious about this and you would rather discuss it when we have it, you don't have to look at that result, but the choice is yours.
What do you do if a patient sees that something's abnormal that you ordered, and if they feel anxious or they don't have context around it? For example, what I'm planning to do with my patients is have that conversation with them about how our normal review process works. So how do I sign off lab work? And trying to reassure patients and have that communication that, we still encourage patients to phone if they're really, really concerned about lab work, but they should also know that base process where we're still looking at lab work and we're still responding to it, if there's something important that needs to get brought back in, they're going to get a phone call.
With true informed consent, I think, and patients being part of that discussion beforehand, I think it will make me a better doctor. The part that causes them the most anxiety is the part from the time of the test until the time of the result comes out. What I've learned is whether the result is good or bad, it's the not knowing that makes you worried. We've seen from some of the results that when people get access to results sooner, they interpret the results and they've got confidence that they understand the results, and the anxiety level goes down.
I think everyone wins in the long term, and that goes with any sort of patient engagement or patient education. When patients are well informed and they're well educated and they're engaged, everything works better. And so this is just one more tool or aspect of encouraging people to take a part in their own healthcare.
The most important thing is that I've always believed in one patient, one record. And this is one of the ways of getting to that goal of having a one patient, one record, where the information follows the patient and doesn't follow the provider. And I think that is the greatest benefit of this. Overall, I think that this is an enhancement to the care that we deliver. It's an enhancement to the patient and physician relationship. And in the end, I think all of us are going to be better off with this.